Hi, welcome to Shobbs Health and Wellness Podcast, where we bring you the latest topics related to health, wellness, and a healthy lifestyle. My name is Shobbs, and I'm the host of Shobbs Health and Wellness Podcast. So this topic is going to be on puerperal psychosis, and I have a special guest with me on this episode. Her name is Nurse Opeyemi. She has years of experience working with new mothers and has seen firsthand the impact of this condition. So I would like you to sit back, relax, and let's dive into today's episode. But then I will be splitting this episode into two parts. Thank you for joining me on today's episode. Let's dive into today's topic. Well, we just finished talking about the risk factor, but I would like us to focus on the treatment that is available.
All right, thank you for that. Before talking about the treatment, I would like us to go to how to prevent it. Like the popular say that says prevention is better than cure, right? Once you know how to prevent something, then treating it would be easier. Let me say, you won't have to get to the treatment. Once you prevent it, you won't have to get to treatment. So let's talk about how women prevent puerperal psychosis before we can now talk about treatment. When you have malaria, they will tell you there shouldn't be water in a place because once water is there, mosquito will breed on it. Mosquito breed, use mosquito net and all that. So the same thing with puerperal psychosis. We already know the causes, just like the causes we listed out. So we'll pick the causes and now prevent it. One thing is avoiding unnecessary top of the list. A major thing that causes puerperal psychosis or that predispose women to have puerperal psychosis is stress in pregnancy. Now, preventing unnecessary stress in pregnancy will go a long way for pregnant women in order to stop them from having any form of depression, maybe puerperal blues, puerperal depression, and even going into puerperal psychosis. So avoiding stress in pregnancy, getting help when you need to, saying things out, talking, relating with your family members, discussing with your husband, seeking help, and all those things will go a long way in pregnancy. Then another one, getting appropriate support from family members, friends, families to perform chores and render some services. I've already discussed it. It's very, very important. It's just like trying to avoid stress in pregnancy. When you get those out, so with that, we can reduce stress in pregnancy. Then getting appropriate support from family members. Okay, I discussed that already. Now, women that have greater risk of having puerperal psychosis, maybe through their family history, they have family history of schizophrenia, they have family history of puerperal psychosis, they need to discuss it. It's very, very important. I know there is stigma attached to that. Yes, nobody will want to say that my grandmother, when she was pregnant, she was having skoin in African culture, right?
Yeah.
Nobody will want to say that. Or nobody will want to say my mom, when she was pregnant, or even when she was not pregnant, she used to have mental disorder. Nobody will want to say that because you want to look at it like people might start tagging you as a mad person.
Yes.
People might start talking about you. You know, the stigmatization is there. And that is what affects mental health because of the stigmatization. People don't want to talk about their mental health because of stigmatization. Yes. They don't want people to point fingers at them. They don't want people to say, oh, so person has been mad before. Things like that. Now, people that have greater risk of having this puerperal psychosis, either through family history, either through previous pregnancies, they need to discuss it with their health providers. Because if they discuss it with their health providers, certain measures will be put in place. Let's say counseling, they'll start counseling the woman. Okay, avoid stress, do this, do that, don't do this, don't do that, right? They'll start counseling the woman during pregnancy, and they will start providing certain medications in place. In case she starts being aggressive, they can give her this medication, maybe diazepam and all that. In case she's going into depression, we can do this. We can just avoid a dark room You can put her in a lighter room. You can put her in a colored room. You can talk to her. You can get family members to relate with her, to shake off that depression off her, right? Yes. So the healthcare provider needs to be aware if a woman is having a greater risk of puerperal psychosis. So that is one of the ways we can also prevent puerperal psychosis. I tell women, as a woman, you get pregnant, you can have puerperal psychosis. As far as you are a woman and you get pregnant, it doesn't limit to anybody. Just like you are a woman and you have breast, you can have breast cancer. Yes. Just like you're a woman that have cervix, you can have cervical cancer. Right?
Yes.
So those things, as a woman, if you take in and you're pregnant, you can also have puerperal psychosis. Right? So I tell women that as a woman and you have this. So once you know you have a greater risk or it has happened to you in your previous pregnancy, you don't even need to tell them you are mad. There's a way I can be talking to my patient that will know what my patient is trying to communicate with me. Maybe the patient will tell me, while I was pregnant previously for my child, I had these drugs they were giving me because immediately I delivered, I was saying things I was not supposed to say. Right?
Yeah.
As a healthcare personnel, it means that, she said they are giving her particular drugs. I'll question the drug. I'll start asking, what kind of drug? Okay, she doesn't know the name. I'll check her file, or I want to know, or I want to ask a family member or her husband. Or maybe I want to know the reason why she was talking anyhow, or the reason why she was saying the things she was not supposed to say.
Yeah.
Right? I'll start questioning those things. And from there, I will know that, this woman might likely have this condition when she delivers this baby. Okay, let's put so and so measure in place in order to accommodate this woman. Let's ensure that this woman doesn't stay alone. Let's ensure that she's surrounded by those that love her. Let's ensure that she's not staying alone. Let's ensure so and so things, right? At risk of having puerperal psychosis, they need to discuss it with their healthcare providers. Is a very good way of preventing or of escalating the signs and symptoms, right? So
yes.
It's very, very important. So those are the major ways which you can prevent it. Avoiding stress in pregnancy, getting support from husband, family, and friends. Then if you are at greater risk of having puerperal psychosis, you discuss it with your healthcare provider so that they can make certain counseling or certain medications or certain support in place in order to accommodate such women, right? So those are the ways we can prevent. They're going to the treatment of puerperal psychosis.
Okay.
Once you know that this woman is having this, she's having that, the first thing is go and see a doctor. And most times I encourage women, once they have been, diagnosed of having puerperal psychosis or any other psychological condition, a specialist, which is a psychiatrist, right? Once they see a psychiatrist, then psychiatrists can take it up from there, give them certain drugs, talk to them about certain support, talk to their family member. In psychiatry, support is very, very important. In fact, it's one of the major things they use in psychiatry. Yes. In psychiatry nursing, support, aside medication, support is one of the major things they use. Because those that are having depression, if they can have family and friends around them to talk to them, to gist with them, it will reduce the depression a bit. And that's why people that are having depression, when you go to a psychiatrist, they put them they share them into groups.
Yes.
Certain things.
Activities, yes.
Yes.
More or less like recreational activities or something.
Yes, exactly. Like recreational activities, so that they don't go depressed. They do that for a purpose, so that they don't go depressed. A community is very, very important when we are talking of psychological cases, any psychological cases, be it puerperal psychosis and other psychological cases. Having a community, having family, having friends that will take it up, that will take care of them, that will talk to them, that will support them is very, very necessary. So taking mothers to see a psychiatrist is very, very important so that they can take it up from there and, go on with the further care. Then, one of the ways we can treat puerperal psychosis again, well, it's not like a major treatment, right? But it's one of the things people around the women must do, which is separate the baby from the mother. If she has shown any suicidal tendency or she has shown that she wants to kill the baby, it's an action. It should be a reflex action that, this woman is saying, I feel like throwing this baby through the window. I feel like killing this baby. In fact, they don't need to talk to the woman again. Just say, okay, you know what? Let me go and feed this baby. You know what? Let me take this baby. Then you gradually collect the baby from the mother. There's another case that we've seen that she refused to leave the baby. She was crying, you are going to have my baby, kill my baby, you're going to do this, and nobody's touching the baby. See, it's crazy, honestly, I must say. When I tell you experience about the mothers in labor ward, like few experience about, honestly, it's not something you want to see every day. It's not something you want to see every day, because it even keeps some women, they become scared. They'll be like, you mean if I'm pregnant, I can have this thing? No, I don't want to get pregnant, honestly. No, things like that. So separating the mother from the baby is very important in the management or the treatment of a woman with puerperal psychosis. Because if you don't separate her and she's having depression, if you don't separate her from the baby, she can harm the baby and harm herself. So, another is counsel the mother and family members. Okay. Like I said, just like we were saying the other time, it's very, very important to have a social welfare, a group of family, a group of friends, a group of people that can support this woman. It really, really will go a long way in the treatment of puerperal psychosis for any mother having family members around. In fact, they don't have a choice. They incorporate it into their care. Aside the medications that they will give them, they incorporate family members and social welfareism into their care so that the women can heal on time and they can go back to their normal life. Then hospitalization, they admit them in the hospital, they take care of them, administration of medications, drugs. Sometimes they even give them diazepam in order to sedate them for some time so that they will sleep, they will get some rest. So when they're having anxiety, they just want to sedate them, make them calm for a bit, or things like that. So those are the ways, those are like basic treatments. It's not something that will just go in a day. So it's a process, right? It's a process. So the things you will do in order to ensure that this woman is in a safe hand. You take her to see a psychiatrist, you separate her from the baby, you counsel her, you talk to her family members to be supportive, they shouldn't be tired, because honestly, it can be draining.
Yes.
I won't lie to you. It can be draining because it's just like you're seeing somebody beside you that is doing something else from what the rest of you are doing. She's just talking to herself, or she's just saying something irrational and things like it can be draining, honestly. So we'll talk to the family members to be patient with them, to relate with them with love and care and all those things before they get back to their usual self. Then hospitalization, administration of medications and all. So those are the basic ways by which we can treat or we can take care of women with puerperal psychosis or other psychiatric conditions.
All right, that's a great advice. And in everything you just mentioned for prevention and treatment, one thing that stood out is the fact that support is very, very important. Support very from family, support from other women that are also pregnant, join having a community. And that's where your own community also comes.
Social welfare.
Yes. So that's just it. Thank you so much for this. But I would like you to share a story about a patient you have treated or you have nursed who had psychosis, and how were you able to support her and her family during this difficult time?
Okay. I love to talk about it, although she's still yet to recover fully. Maybe when she recovers fully, when I visit her, I would like to know if she wants to. Like, I can't force her, right? But if she wants to, I would like her to do a voice recording, or maybe I'll just take my phone there, tell her to speak about her journey. It's easier when you hear from the person that it happens to, how she was able to cope, how she felt when she was all right, and all those things. So it happened when she delivered her baby, right? She was a first timer. So she delivered her baby. She was my colleague. Let me say my colleague. She wasn't a nurse, neither was she a midwife, but in my hospital, she was among the customer-related services and all that. So after she delivered, we went to see her, we went to greet her, and she was fine, welcoming and all that. So until the third day of delivery, some of our colleagues went to see her, they went to greet her, and when they came back, they were telling me that, so thing happened. I said, what happened? They said she was opening a private area in front of everybody. Come and see my bum. Come and see this. Come and see inside. She was opening, and they were like, what is wrong with you? Why are you, men are here, female? I said, I don't care about them. Come and see. She was opening. She removed her wrapper. She removed everything. As a woman who just delivered, she wasn't wearing too much of tight clothing yet. Yes. She was just wearing so she removed everything.
Wow.
And they were like, what is happening? What is going on? So they felt like maybe she was still excited. She was still having mood disorder. That was what everybody actually thought. That maybe she was still having mood disorder. She was still in a phase of excitement.
Yes.
Let me put it that way. Yeah, that's what everybody thought. But until another 3 days, making 6 days, she just went to the general platform of more than 600 persons. Then she wrote to the platform, so my name is so I am going to meet in the next phase of life. And everybody was like, what is happening? And everybody was like, what is happening? What do you mean by to meet in the next phase of life? People started running to her room to go and see her. Right? They started running to her room. They ran to her room. They told her that, what is happening? Why are you typing? They said, yes, now, because she's going. We are going to meet in the next phase of life. She's already going. She's already going. Everybody held her. Like, there is a problem. She's not somebody that will say that kind of thing.
Yeah.
She's not somebody. So they now had to flash back to 3 days ago. That, okay, 3 days ago, we had the same encounter with her. She opened all of her body. She was, kind of naked, and she was telling everybody to come and see her private parts, to come and see that, to come and, it was now going too extreme that they had to collect a baby from her. They had to start talking to her. Why they were even talking to her, she doesn't even care. She was just saying her own, and this and that. I'm going, I'm doing this. We'll meet. When we meet, we'll discuss. When we discuss, she started saying so
different
many things. Rational thoughts. She started saying so many things. So she was in the hospital. They had to discharge her baby home. They had to discharge her husband and her baby home, and they left her in the hospital. So they had to invite a psychiatrist to come and see her. So after interacting with her, the psychiatrist said she has a mental condition, that she has puerperal psychosis. Right? So that was where the whole journey started. The psychiatrist said they would give her appointment, they would talk to her. They had, I think one of our close relations started crying, and we had to advise them, you don't need to cry. What you have to do is you ask for a way in which you can support her. If you don't support her, it can escalate. And we thank God that we were able to detect this on time while she was still in the hospital, not while she was at home, right? If she didn't put it on the platform that so thing is happening, and everybody rushed to her room and they noticed that she can do anything at home, right? If she has been discharged, she could actually do anything, maybe kill her baby or do something to injure herself or kill herself. She was actually having suicidal tendency. Yes. That's why she was saying, I'm going, we'll meet in the next phase of life, we'll do this, we'll do that. She was having suicidal tendency. So if they were not careful enough, she could carry something to injure herself or even kill herself. So that's it. I like to share that story because it's a different feeling when you see somebody that is closer to you have that kind of event, and a different feeling when you see somebody that is far away from you. You can easily talk when it's somebody that is far away from you. But when it's somebody closer to you, somebody you are seeing day in, day out, you'll be like, what is happening? And all those things. So we're still following up on her. She's still on her leave. She's resting. She's not taking care of her baby yet. Medications are helping her. Yes, they're helping her to take care of the baby, and she's also taking her medication. So I just hope, although I'm still planning on calling her, maybe if per adventure, going to her house, speaking to her husband and asking how she's faring, then how she's going, and how she can speak to me on one or two things. So discovering it is very, very important. Being sensitive. Is very, very important. Very, very important.
That's it. She was even smart enough to put it on the platform. What if she didn't put it on the platform?
Honestly speaking, exactly. What if she didn't put it on the platform?
Yes, that's it. So, and she's just quiet. She got home and the whole thing now started.
Yes.
God so help her.
Exactly.
Her husband is always with her, or people will just come and wait for her child and leave her. Sometimes they will come and take care of your child and they will leave you.
Maybe
Exactly. Yes. And then you'll be the only one doing everything. They'll come back in the evening, So really, I think at this point, for every pregnant women, the moment they are even at 8 months, they should have people around them, people that they can interact with, if possible. It's so painful, but I wish this woman quick recovery. I'm serious. Like, see the way I open my mouth now, like she wants to express my body. This pregnancy is the old.
It's not.
Pregnancy is not for the pregnant heart at all. First trimester you have. For the week. I'm telling you, first trimester you experience something. Second trimester you experience another. Third one, even the fourth trimester that the baby is out already.
Honestly, the baby is out already. Honestly, we are battling with so many things.
Sincerely.
We are battling with so many things. It's not easy. It's not an easy journey. That is why we call it a journey, right?
Yes,
it's not a one-day thing. It's a journey.
Yeah.
It's a journey.
Yeah, you're right. Okay, so thank you. Thank you so much for the advice. But this is the final phase, though. I want you to advise that. What advice would you have? You give to new mothers who are concerned about their mental health, and how can they actually take care of themselves during prenatal and postnatal period? Yes.
One thing I usually tell people is that, number one, always speak up. Always speak up. No matter what you're going through, always speak up. If you've had puerperal psychosis before, or you are having similar symptoms, or forget people that will laugh at you, or forget the fact that people will point fingers at you. It's better that people point fingers and you are better. You are fine. You get help. You get treatment on time than when you don't speak up and you keep it to yourself. Then at the end of the day, the condition escalates. So always speak up. If you are a woman, always speak up. Talk about your experience. Let other women hear. Let other women learn from your story. Let other women know the ways. Let other women have strength from your story that, this person went through it and this person survived. That means me too, I can survive. That means I can go through it as well, and I can survive with it. Another advice I will have for women is, in as much as you are trying to do other activities during pregnancy, please, I beg of you, try to rest. Try to reduce the activities you do. Try to avoid unnecessary thinking, unnecessary pressure on yourself. right? Because those things will accumulate and become stress at the end of the day. So women out there, whoever is hearing this, whoever is listening to this podcast, I want to advise everyone that pregnancy is not a day journey. It's a long-term journey. Even for the fact that you're pregnant and you deliver, it's still a journey. Try as much as possible to also consider yourself. Try as much as possible to be sane for yourself. Try as much as possible to be healthy. When I'm talking of healthy, I'm not only talking about physical health. I'm talking about mental health. I'm talking about psychological health. If you have a problem, speak up. If you have been through it before, speak up. If you need to get answers, ask questions. If you need to get medications, speak up. If you need to get solutions, speak up. Don't just keep it to yourself, because when you speak up, you can easily get solution to your problem. And also, the people around the women should also be attentive. They should be very, very vigilant when you see anything that is going on that is not supposed to be, or that is unlike the person usual. Then you should question the person. When you don't understand, speak to your healthcare provider and they will give you solution to a problem. So basically, that's what I have to say.
Thank you so much, Matt. So you talked about, speaking up and also connecting with other women that maybe they are also in the same season that you are. And I want you to talk about your community. I know you have a community for pregnant women and you coach them, you train them, create awareness. So I want us to talk about your community now. How can people join? What impact does your community has on pregnant women?
Okay, basically now we have a community of more than 500 women.
Yippee!
Right? And it's termed the Pregnancy and Delivery Support Community.
Wow. So maybe I will join your community very soon. Make I go get belle.
No problem. Feel free, but you're not pregnant. Yeah. You're welcome anytime. Feel free. Okay. So it's termed the Pregnancy and Delivery Support Community. Okay. It's called the Pregnancy and Delivery Support for a purpose. We wish to give support to all pregnant women out there. I want to influence as many as possible. I don't want to put a number to it or put a particular figure to it. As many women as possible. In our community, we talk all the time. We have sessions. In fact, after this podcast, we're having sessions later in the evening, and we are going to be talking about induction of labor. And the women are already excited. One woman reached out to me that she lost a baby because she was wrongfully induced. And that was what prompted me to wanting to talk about the topic induction of labor. When should you allow them to induce? When should you not allow them to induce? So many women are dying of so many pregnancy-related conditions and pregnancy complications because they don't have the necessary knowledge they are supposed to have. That's right. True. Yes. And that is why I took it upon myself. That you see this community I built, this pregnancy and delivery support community, I am going to use it by God's grace to reach out to thousands and millions
of people,
as so many women as possible. My brand is called LOK Natal Care. Natal Care, I crafted that name Natal Care from prenatal, that's before pregnancy, natal during pregnancy, and postnatal after pregnancy. So Natal Care, the care encompasses both before pregnancy, during pregnancy, and after pregnancy. I just wrote a book. I don't know if you've seen it. I've launched the book. The title is Do Not Eat in Pregnancy.
Wow.
I am going to give out that book for free. Yes, I said it. And someone came to my DM and was like, you don't need to give out this book for free. You can sell it. And I'm like, see, I know I spent money on this book. I spent efforts, my energy and everything. But I am giving out this book for free because a lot of women don't pay attention to what they eat during pregnancy.
That's true.
Right? And that is why I'm pouring my knowledge into this book. They need to be aware of what they need to eat and what they don't need to eat during pregnancy. They need to be aware that healthy eating is healthy baby. right? Yes, we can eat anything. You can eat anything because a mad woman on the street, permit me to use that word, a woman on the street that is not feeding well, she'll still have a baby. But the question is, are you having a healthy baby? That's the question. Are you having a baby free from illness, free from sickness, free from so many conditions? Are you having those babies? So those are the knowledge that I poured into the book, and I'm sharing it out to women for free. I have more than 100 women on the waiting list currently that are waiting to get that book. I have online antenatal session, and it's going to be for 3 months each. First trimester, 3 months. Second trimester, 3 months. Third trimester, 3 months as well. I call it powerful 3 months because it's not just going to be the regular 3 months. Honestly, it's not just going to be the regular 3 months of going to the hospital to collect drugs. It's going to be 3 months of sessions back to back, 3 months of knowledge, 3 months of change, 3 months of the pregnant woman knowing what she's supposed to know, 3 months of pregnant woman knowing what she's supposed to expect during delivery.
Wow, I'm so happy for that. So can you tell us how we can follow you, how we can reach out to you on social media, and if possible, how we can join your community?
Okay. On social media, I'm on LinkedIn. On LinkedIn, my name is Nr Opeyemi. Nr Opeyemi. Okay. Yes, on LinkedIn. Then on Facebook, they can follow our LOK Natal Care. Then on WhatsApp, I don't know how I'm going to drop my WhatsApp number so that those that have interest, they can actually, or should I call it out? Should I call my WhatsApp number out?
Okay, you can call it out if you don't mind.
+234 81 42 30 8899. +234 81 42 30 8899. So anyone that contacts me doing that, I'm always open. I'm always open to women. I want to have women. I want to influence them. I want to empower them with the knowledge I have, right? Okay. I want maternal morbidity and mortality rate to reduce, especially in the aspect of Africa that we are, right? Yeah. We don't have everything in Africa when it comes to health. So these women, if they have this basic knowledge, then it will be easier for them to navigate through the 9 months journey and having their babies.
All right. Thank you so much for joining me today, ma'am. Thank you for sharing your knowledge, your experience with us today. I hope this conversation will not end here.
Thank you so much, Sarah, for having me on board and for having me here.
Thank you for tuning in to Shobbs Health and Wellness Podcast episode on Puerperal psychosis. I hope you found today's conversation informative and helpful, right? Yes. Okay, so if you have any question or comment about this topic or any other health related issues, please reach out to me on my social media platform, or you reach out to Nurse Opeyemi on our social media platform. Thank you for tuning in. Please don't forget to drop a review, drop a rating on any of the favorite podcast platform that you're listening to this episode. Thank you.